At least 3,091 people have died from Ebola since the West African outbreak was first reported in the remote southeast forest region of Guinea in March this year. The other two most affected countries are Sierra Leone and Liberia. The outbreak has overwhelmed health systems in one of the world's poorest regions, prompting the United Nations, international organizations and foreign governments to increase support for the affected countries. And now, the UN mission to combat Ebola wants to see significant progress in fighting the deadly disease within the next 2 months, including ensuring that 3/4 of cases receive treatment.
70% of infected people need to be under treatment, and 70% of burials need to be done in a safe way in order to turn this around. And they say we need to do it in 60 days. If left unchecked, the number of people affected by the disease could reach 1.4 million by January. And then every country in the world would be at risk. Very, very serious risk. Not just the health of their people, but their economies, their social structures, their political structures. The world must act now.
One major challenge of the UN mission will be liaising with those nations as well as with other organizations and the affected countries themselves.
It's an extremely ambitious target. And the only way it can be achieved will be through this international effort. We need this kind of world-class expertise to help us design this operation as quickly as possible and as smartly as possible.
In some past emergencies, poor coordination, disagreements, and even rivalries between governments and between aid groups slowed the response. However, the UN mission said it will not provide any medical services, but focusing instead on policy, expertise, logistics, and ensuring there will be no gaps in the plan. Olatubosun Olawale, TVC News.